Hello, everybody. Dr. Kevin Connors with section 16 of the Stop Fighting Cancer book. Again, talking about some favorite therapies I love. Again, if you have any questions, if you're interested in contacting our office, please do so at the number below that you see on this slide. In this section, we're going to talk briefly on medicinal mushrooms. Maybe my favorite nutraceutical because we've seen it work literally like magic. I don't like to use that word, but it's just amazing how mushrooms work. Matter of fact, I did a whole presentation on mushrooms, about a 20-minute presentation on mushrooms that's in our Connors Clinic online program. Um, because mushrooms are just so phenomenal. Um, I literally, honestly, didn't use very much medicinal mushrooms until about 5 or 6 years ago when I don't remember how I got into them, but they started to test out so well on patients that it just blew my mind. It's just so beneficial. We've just seen so many great results with medicinal mushrooms that we use our own special blend of medicinal mushrooms that have more things in there than just the medicinal mushrooms, but it is just a great tool to use. We use just a powdered blend equivalent of about a tablespoon of our blend on a daily basis, typically with patients. It's just a great protocol to add. Also, Protocell. Protocell came into being a number of years ago as, what was it called? Cancel? I forgot what it was called. It's marketed that same way in Europe now, but in the US it's marketed as Protocell. There's only one company that sells Protocell, that distributes Protocell. It's out of Florida. We sell it at their cost to our patients that need it as well. There's two different types of Protocell: the Protocell 23 and the Protocell 50. One is for most cancers. The other one is mainly for prostate cancer. Protocell is a great program. Now, understand it with the Protocell literature talks about you can't use it with a Rife machine. It's talking about with an electrical Rife machine, not the light frequency Rife machines. We use it with Rife all the time. It doesn't test out as well since we started using medicinal mushrooms. Actually, we had more people on Protocell before we started using our own medicinal mushroom blend that's much cheaper for patients. It just seems to work so much better for patients. But Protocell is a great program. There's a couple books on the market. I should have put a picture on them here of the books. We sell it in our office because it's a really neat story of a personal experience with Protocell that a person had that the Protocell really helped the chemo work much better, and it was very beneficial. Now, understand, even though I'm giving you all this stuff in this book, I think it would be a horrible detriment not to say that my belief is that if you did too many of these things, it could be very harmful for you. So remember my code of law that anything that you absorb that your body can't use, your liver has to detoxify. So if you're taking Protocell and mushrooms and echinacea and garlic and enzymes and many other things in this book, and your body really only needs the mushrooms, all that other stuff has to detoxify through your liver detox pathways. And you do not want to overwhelm the liver detox pathways of anybody, let alone somebody who's trying to kill cancer cells. So too much of a good thing is a bad thing. Too much of a good thing is a bad thing. And anything that you absorb that your body can't use, you have to detox. Anything that you absorb that your body can't use, your liver has to detoxify it, and you will overwhelm your liver detox pathways. So you do not want to take things that your body doesn't need. So you need to have an adequate way of test for that. So find somebody that can, if you can't come to our clinic. All right, I hope this is beneficial for you. I hope you enjoyed this section. I will talk to you soon.